Welcome to HealthCast, a production from Lexington Medical Center that focuses on the latest procedures, treatments, and the people behind the exceptional care we provide to patients. Today, we're exploring allergies. It's estimated 25% of the population deals with some form of an allergy that affects the nose and eyes. Here at Lexington ENT Allergy, relief from those nagging symptoms is possible. For anyone with allergies, dealing with the reactive symptoms is uncomfortable.
It's kind of been a constant struggle at different times of my life.
To relieve those symptoms, Abby is being treated at Lexington ENT Allergy, a Lexington Medical Center physician practice. Dr. Brian Heberlin is the medical director of Lexington ENT Allergy. He is an ear, nose, and throat physician specializing in allergy, immunology, and otolaryngology. The allergies he sees most often are from tree, grass, and weed pollens, dust mites, pet dander, and mold.
You know, an allergy is where your immune system is mistaking a pollen or a dust mite for like a germ or a bug. And so it's kind of making this attack on that. And so we hope with allergy shots, we lessen that immune response that your body is having.
Having trouble breathing, feeling like my eyes and my face are itchy, that my nose is running, and you just kind of feel like you're sick even though you're not necessarily sick. It's just the allergy symptoms that are persisting.
Like most people, Abby first tried over-the-counter medications, but those were not effective. So she went through the test procedures at this clinic.
The major ones that we focus on are people that have failed medical management with just some of the common over-the-counter medicines.
The staff used one of two different methods to test for allergies, a skin test or a blood test. Dr. Heberlin prefers the skin test, feeling it finds more allergens and is less expensive. There are two stages to the skin test.
The first step is this thing called a prick test. It almost looks like the end of a hairbrush with some plastic sharpish areas. They dip that in some pollen and molds and so forth, and they place that on your forearm. And we usually do a battery of about 37 items that's there. So it's 10 at a time, so it's 4 pricks with this thing of 10. And then we wait 20 minutes and we see how your body responds to that medicine that it kind of barely put beneath the skin surface.
There is minimal discomfort, but the patient will feel slightly itchy. After the prick test, the skin testing continues with an intradermal procedure.
And that's where we take a small amount of each of those things, and we do give you a little tiny shot in the outer part of the arm. And we measure that response in 20 minutes.
With the results from the two-part skin test, the doctor then is able to determine what the person is allergic to and the severity of the allergy. The other testing option, which is a better approach for certain patients, is a blood draw.
If you're allergic to ragweed, for example, your body makes this thing called immunoglobulin E, or an antibody is another way of saying that, and it attacks the ragweed. And so you're trying to measure that really, really minuscule amount of immunoglobulin E that's specific for ragweed that's floating around in your bloodstream.
And for further testing, the doctor can put this tiny fiber optic scope into a patient's nose to look at the structures for a full sinonasal picture. Without these tests, it's unclear whether a person actually has allergies or other nasal conditions.
Typically, the symptoms that kind of distinguish allergies from more of a cold or sinusitis are more of the sneezing, the itchy, watery eyes, having some seasonal component to the symptoms where they're bad in the certain times of the year when pollen's out, worse when they're outdoors, or other things would clue us in that allergies are part of the problem.
Within the clinic, there are 3 allergy rooms for administering testing, injections, medications, and immunotherapy.
The medications that we use are trying to kind of either stop or block a part of the allergy reaction someone has, whereas the immunotherapy is really trying to fix your immune system and undo the programming of your immune system where it's attacking things that it shouldn't attack.
Patients do not need a referral to be seen here, and while medical management can start with your primary care physician, there are benefits to seeing an ENT allergist.
The things that we can do is do some of the allergy testing. We can also just do a more thorough evaluation of someone's nose and nasal conditions.
And what happens if a person leaves allergies untreated?
They can get worse, and there's something called the allergy cascade where people may have just nasal issues at first. Left untreated, they can get worse and worse over time. People can then develop asthma and other lung issues, which are kind of all tied into your allergic process as well.
The goal at Lexington ENT and Allergy is to be able to eventually end a patient's regimen of allergy shots.
You don't typically want to do allergy shots on somebody for more than 3 to 5 years. So it's usually a weekly shot for the first couple of years, then we back off to every other week or monthly, and then we taper off.
Dr. Heberlin says, thankfully, with a proper diagnosis and treatment plan, people can gain control of their symptoms. It's no wonder U.S. News & World Report named Lexington Medical Center as the best hospital in the Columbia metro area for the 3rd consecutive year. The board-certified physicians, audiologists, and advanced practice providers at Lexington ENT and Allergy provide world-class care right here at home by helping you and your family breathe easier, hear better, and sleep sounder. To learn more about the advanced treatments performed at Lexington ENT and Allergy, please visit lexington-ent.com. And be sure you hit the like button and subscribe to our channel to get notified of future stories in the HealthCast series.